We're taking your calls today for Dr. Zorba Paster, 608-270-9933.
Zorba, welcome back. Let's get to the phones. We'll start with Lorraine in Madison. Hi, Lorraine. What's your question?
I want to know with the Omicron virus, the percentage of those who are unvaccinated that have gotten it, are they the majority that are hospitalized or those who aren't unvaccinated?
The majority of hospitalized are the unvaccinated. The unvaccinated, this basically is an epidemic of the unvaccinated people. If everyone in the country were vaccinated, this would be probably more like a bad case of the flu or common cold. But until we get to herd immunity, it's not going to happen. Everyone should be vaccinated.
And so this is just because this variant is so infectious. That's why so many fully vaccinated people are testing positive? Is that what's happening?
It's exactly what's happening. It's very infectious, but it doesn't seem to be as serious as Delta. In other words, your risk is actually less than it is with Delta, but because it's so infectious, so many more people, the unvaccinated, are actually getting COVID, and many people who are vaccinated are getting it, but are not having serious cases of it unless they have other problems.
Okay.
Let's go to Dave in Wanakino. Hi, Dave. What's your question?
Well, I just had a question for Dr. Zorba. Why in the last few months they've said that you no longer have to take the low-dose aspirin every day like we've all been doing, and what the reasoning is for that?
Sure. We now have very good data. We used to think everyone should have low-dose aspirin after a certain point. Then we now have good data that if you have, for instance, have had a heart attack or had a stent, you need a cardiac stent, you need to have low-dose aspirin. But instead of giving it to everyone, we've now looked at the data. It's what science is all about. And it appears we're causing more problems with that, with GI bleeds and the complications. So the recommendation is low-dose aspirin if you've had a heart attack, if you had a stroke, or other medical problems where your doctor says you should be on it, but it shouldn't be willy-nilly that everyone over a certain age should take low-dose aspirin.
All right, very good. Let's go to Sue in DeForest. Hi, Sue. What's your question?
Hi, doctor. Just wondering, my son was fully vaccinated. He had a breakthrough case of COVID right before Thanksgiving, and he was supposed to be boosted a couple days after that. So I'm just wondering if he has to wait any longer, or can he go ahead and get the booster?
You can get as soon as you feel okay, get boosted. There's no reason to wait. There's no absolute number that you've got to wait a certain number of days afterwards. From what I've read, as soon as you feel all right, get the booster, because that's going to make sure you don't get another case of COVID again. Remember, you can get COVID more than once. You can get it twice or 3 times. And the more you get it, the more likely you are to have a complication with it, such as my patient who lost her sense of smell, which is really not great.
All right. Let's go to Deb now in Dodgeville. Hi, Deb.
Hi. My question is the flu going as much as what COVID is right now? I've had symptoms not to pertain to COVID necessarily. I've had a severe headache and then diarrhea that has continued from Tuesday all through today.
Mm-hmm. Well, the flu's around. It's not around as much as COVID. We've got influenza around, but influenza is not really prominent within the community. And even with those symptoms, you might have influenza, you might have another virus, and you might have COVID. And so if you feel like you're sick, you feel like you're ill, get tested for COVID, because COVID can mask as many different things.
But you're not seeing a widespread flu outbreak right now.
We do not have widespread. We've got it, but it's not widespread.
All right. Eileen in Baraboo. Hi, what's your question?
Yes, I finally convinced my brother to get his shot. His first one, he had a really bad fatigue and
just a reaction
all over. Is he able to have the second one?
Yes, absolutely. You should definitely have the second one. Take some Tylenol, better than ibuprofen. It's really kind of better because ibuprofen is an anti-inflammatory, so we go to Tylenol first. And make sure he gets hydrated. He may not have the same reaction to the second shot, but definitely have it. And if he's got a reaction, you say, well, you really don't feel good on one hand, but the risk of death is much less on the other hand. So definitely have the second one, and just make sure that you hydrate and you stay as well as you can when you get that.
The vaccine is working. That's the reaction.
Your body, right, it's doing what it's supposed to do. Let's go to Tammy in Madison. Hi, Tammy. What's your question?
Go ahead, Tammy.
Tammy, are you there?
She wants to know why Delta disappeared.
Yeah, that's a good question, actually.
Well, Delta is in the background because Omicron is simply taking over and just sort of wiping it out. So it hasn't fully disappeared, but it just is Omicron is maybe 5 or 10 times more infectious than Delta. So Delta is in the background. That's what viruses do. The ones that are stronger take over from the ones that are weaker. It's the evolution of RNA viruses that continually mutate.
Get vaccinated. Let's hope for a better 2022.
Yes.
Yes, for sure.
Happy New Year, Zorba.
Happy New Year to you guys, too.
All right.
Great to see you. Thanks so
soon.
much.